Recently, I've been asked by a couple of patients, what is pyroluria? They wanted to know more about it because it had been mentioned as a possible cause of some of their symptoms, such as anxiety and depression. In one case, there was a patient who had asked about if the pyroluria may be causing their attention deficit. The answer to all of them is yes, it's possible. So what is pyroluria? How do you know if you have it? And how is it treated?
Today on Ask Dr. Gil, we'll be talking about pyroluria and how that can affect your intuition. So stay tuned. Hello and welcome to Ask Dr. Gil. I'm Dr. Gil Winkelman, and today we are going to talk about two topics that will actually be related. I mentioned in the intro about pyroluria. Pyroluria is a fancy way of talking about molecules that show up in the urine. The molecules are called cryptopyrroles. They're basically a molecule that represents something that wasn't completely broken down in the body, and it shows up in the urine. And I will tell you a story about those and how it affects mental health, and how you know if you need to be tested for pyrroles in your urine. But before we get into that, I want to talk about the other topic, which is related, which is about where the podcast is going. And I've been sort of struggling with this and wanted to share with you, my listeners, regarding this. I thought about just restarting the podcast because I realized I hadn't given any context. I started the podcast, I threw a bunch of shows up, and if you listen to all of them, it doesn't sound like there's a thread that moves through them. It just sounds like it's a bunch of questions. And that's not what this is really about. Initially I did those recordings because I found myself answering the same question in my office when a new patient would come in. And so that's why I wanted to record those, and I did that and I put them up. But really this is about something bigger, if you will, which is about the connection between the mind, the body, and the spirit. And in fact, if you look at my website, AskDrGil.com, there is a tagline in there that says, "Restore heart, body, brain balance for optimal health." And so as I was doing preparation for the Pyrolyria podcast, I thought, what better way to introduce this than to talk about pyroluria? And the reason is that pyroluria represents something that is physiologic, that interferes with our ability to be emotionally and spiritually stable. And I use spirit sort of in a broad context, because I do think it's an important aspect of health that is not quantifiable at this time by science, although there is some research from the Heart Math Institute and others that suggests that there is an aspect of our heart that is able to connect to something greater. And I'm not going to cover that in this program, but I am going to say that this is part of the context of what Ask Dr. Gil, the podcast, is about, and also Ask Dr. Gil in terms of how I practice medicine and what I write about and so forth. So the basic idea here is that we need to be aware of the fact that we're not just biological beings, but also mental beings and dare I say it, spiritual beings. There are many things that we see in the research that are totally not explainable based on our current theories. And so part of the purpose of this podcast is to push the science in a sense, and not be dogmatic about the science and say, well, we can't measure that, therefore it doesn't exist. But to say, geez, I don't know what that is. Maybe this is what we're seeing. So that's the context in terms of the podcast. Now, I do want to just finish one aspect of this, which is to talk about there's a book called The Power of the Heart by a gentleman named Baptiste de Pape. I may be butchering his name. It's in French. He also created a movie about it, but it's a wonderful book to talk about some of these issues. And I will refer to it in other podcasts just as an FYI. He actually went around and interviewed a bunch of, a few scientists, Roland McCready and Howard Martin from HeartMath, but he also met with thought leaders, Deepak Chopra, Gary Zukav, as well as authors such as Maya Angelou, Isabel Allende, Paulo Coelho, to talk about sort of how they experience what their meaning of following the heart is. So there's this aspect of being able to follow your bliss, if you will, as Joseph Campbell says. My goal as a physician is to help patients get to that point. And I really believe that oftentimes our physiology, as well as our mental processes, can interfere with our ability to hear that still inner voice and that intuitive sense that allows us to follow our bliss. So that's the context. And with that, let's talk about Pyrolyria, because this is such a wonderful example of a physiologic imbalance that interferes with this. So let me kind of give you a brief overview of the symptoms of Pyrolyria. So one of the silos, if you will, of my training has to do with the Walsh protocol. And there's a few articles on my website. In fact, there's one, askdrgil.com/Walsh, WALSH -protocol. And you can read a little bit about it. Dr. Walsh is now founded a place called the Walsh Institute, and you can get more information on his website about his protocol. He basically looked at depression, schizophrenia, psychopathic and sociopathic behaviors, autism, anxiety, Alzheimer's, Parkinson's. And he discovered a series of subtypes that show up biochemically. And these subtypes are measurable either through hair, blood, or urine. And I'm going to just sort of table all of that for the moment as far as the details, because we're going to talk about Pyrolyria today. Pyrolyria is one of those subtypes. And what's interesting is that you can see high levels of pyrols, for example, in someone who's schizophrenic, but also someone who is depressed, as an example. And we don't know why patients with cryptopyrroles might show up with behavioral disorders, depression, or manic depression, or schizophrenia. Like that, we don't really understand that, but we do know that if they have one of those, quote, diagnoses, that we can measure certain things and figure out where that's coming from, and based on where that is, we can then treat it. And cryptopyrroles is one of those. So some of the qualities of the diagnosis will change based on the biochemistry, and it gives us a sense of what to look for. So some of the qualities, the symptoms and traits of a pyrrole disorder could look similar to another subtype, but usually there are hallmarks about each that allow us to distinguish. And usually if you were a patient, you came to my office, you said, hey, I have depression, we'd look at sort of your life and so forth and rule out something that's happening that's more situational, and as a quick aside, I've had a ton of patients who were prescribed psychotropic drugs, Prozac or a mood stabilizer. because they were grieving after their parent died. Now, that's not a biochemical issue in most cases. That is a situational issue. And in a situational issue, it's more important to kind of go through that experience, depending on what the situation is, obviously. But in a grief situation, feeling the feelings, being aware of what's happening, being okay with what's happening. Now, obviously, if the parent died 20 years ago, that's different than if the parent died a month ago. And, there's a fine line there at certain points. And, I may save that as a topic for another talk. So what does pyral schizophrenia look like? Well, Dr. Walsh, by the way, has a book called Nutrient Power, Heal Your Biochemistry and Heal Your Brain. And a lot of the things that I'm going to read off, I've either seen in my clinic, but it's also what I screen for in patients. So obviously, we see elevated cryptopyrroles in the urine. Sometimes the urine will actually turn like a mauve color or really, really dark. And the patient will say, yeah, my urine is really, really dark. I drink a good amount of water, but it's really dark. And they're not eating beets or something that might otherwise change the color. But the thing that I usually see with the cryptopyrroles is that there's poor stress control, and they will have outbursts, and they won't know why they're having outbursts. And I'm going to talk about a case that I had in a moment. But usually they'll have morning nausea. They won't eat breakfast. And often they'll have pain on their left side, like just below their rib cage and their abdomen. That's most common that I see. But they can have other things. They can have, irritability. They can be sensitive to light, sound. They can have white spots on their fingernails. They can have really weird fears, like fear of airplane travel. And there's a whole list in his book, and I may put that up on my website at some point as well. And you can't really go just by the list. It's important that the test be done, because for one thing, the test will, you can treat and then find out if the treatment's working. So let's take a break, and in the second half of the show, we'll talk more about Pyrolyria. Okay, welcome back. This is Dr. Gil Winkelman, and we're talking about Pyrolyria today, and I mentioned some of the symptoms that show up, and I want to give a case example. So I had a 4.5, 5-year-old girl come to my office. She was a good kid, and I say that because one of the things that Dr. Walsh talks about in his research is that he actually started with serial killers, and he found that when he was working with he was doing volunteer work at a prison, and he was working with these people, and he was like, they don't seem like bad people. They did bad things, but they don't seem like bad people. So he started testing them and doing blood tests and so forth and urine tests, and he found that they had cryptopyrrole levels in their urine 10 times above high normal. And so he was like, okay, now we're getting somewhere, And so one of the hallmarks of the Pyrolyria is you can have a good person do bad things or have bad behavior because there's spikes in those levels that happen. And so physiologically, and I'm going to get back to this 4-year-old, 5-year-old girl in just a minute, physiologically, Pyrolyria really just represents high levels of oxidative stress in the body. And for whatever reason, there's an incomplete breakdown of these rings in red blood cells. They're heme rings, but there's other rings in the body that hold metals, and they are used as a way to either the metals used in like in red blood cells. It's used to create the heme ring so that it can bind oxygen, but other types of these exist to bind other sorts of things in the body and transport them. In cryptopyroluria, there's an incomplete breakdown of these, and they go around and they'll rise and fall. The levels will fluctuate, and they will gobble up zinc and B6 in the body. So why is this significant? Well, it can lead to outbursts that seem uncontrollable and random. And this little girl was a good kid, like I said, and she would have 3-4 hour temper tantrums. And at the end of it, she would cry. Like, her parents basically described her as being possessed for those 3 to 4 hours. And she would cry and be really remorseful about it. And she just didn't understand what was happening. And her mom brought her into me, and I immediately knew what was going on because of my work with Dr. Walsh. And we tested her urine, and lo and behold, her pyroluria. She had high pyrols. They were in the low 20s, not at a level that you would see sociopath behavior. So she ended up doing the treatment protocol, and all of her temper tantrums disappeared. So the treatment is actually really easy. You prescribe zinc and vitamin B6, and the protocol varies slightly based on the patient and their size and what the severity of the symptoms and what else is going on. But that's the basic idea. You're basically reflooding the body over time so that the body doesn't the body can sort of respond and then kick out the pyrols and replace the zinc and so forth. Now, what this protocol doesn't do that I can tell is it doesn't reverse the oxidative stress. So there's other things that you would want to do to treat that, and that's a much more complex discussion than this. But that's the basic idea, and I will give the caveat that if you are going to get tested and see if you have pyroluria, if this sounds familiar and you're going, oh my God, this sounds like my sister or my mother or me or whatever, I do recommend you get a qualified trained clinician to help you. And you can find one on the walshinstitute.org. There's a list on their website of the trained professionals that have had the training from Dr. Walsh with pyroluria. Certainly there's other people out there as well. They don't have the full picture necessarily that the Walsh people have. So that's the main thing that I would say about that. So that's pyroluria in a nutshell. And just bringing this back to the first part of the discussion, this little girl is such a great example because she was such a sweet kid, and yet I knew that when she was in one of these states, interestingly, I had never seen her in that state. I had other patients that I had seen both the states, both the Dr. Jekyll and the Mr. Hyde, and it was the first few times that it happened before I knew about pyroluria, I was like, wow, what the heck is going on? And but it's so fascinating to me to think about it in the context of heart and of spirit, because if you're in that state, how are you going to access that inner wisdom and hear that still, calm voice that's going to be able to guide you, even if you're not throwing a full-blown temper tantrum? Maybe you have a milder form of the symptoms. You just don't feel quite right. Maybe you're slightly depressed. You see the world as in black and white, mostly black at that time. It's hard to access this still point, this feeling of gratitude, this feeling of expansiveness. And without being able to do that, suddenly the world is bleaker than it might otherwise be. And imagine now you treat that, and all of a sudden, you're able to have a different perspective. So that's where these sorts of protocols, these nutrient therapies, are so powerful, because there's no side effects to them, and you're basically using your body's natural ability to adjust the physiology, and thereby you get greater access to this quality of inner peace and so forth. So that's what's exciting to me about nutrient therapy. And you don't have these side effects. You don't feel like you're drugged. You don't feel that you're different, that you're not yourself. So that's all I have for you guys today. I really hope you enjoyed this, and I hope that the context of the conversation is helpful that I'm sharing with you, and that's going to be the context going forward. I'm going to be bringing that more and more in. I'm going to be bringing that into the blog post and the information that I'm putting on my website. So if you like this, please give me a good review on iTunes. That's really, really helpful. And as well as, if you have questions, you can send a question to info@askdrgil.com, askdrgil.com. And if you have a topic that you want to cover, feel free to send it to the same email. Thanks for listening, and I will see you next time